Hello, my name is Nicky Adrian. I'm a consultant child and adolescent psychiatrist and a senior lecturer at St George's Medical School. I'm going to talk to you today about an introduction to child psychiatry. It's a series of 3 lectures. In the first of these 3 lectures, we'll be covering the epidemiology and the role of diagnosis in child and adolescent mental health disorders. We'll talk about the general prevalence of CAMH disorders and the factors that affect these. What is a child and adolescent mental health disorder? It is any form of emotional distress, difficult or strange behaviour, or any deviation in psychological development. In order to be classified as a disorder, the child needs to show some suffering or impairment of normal function, and this needs to be outside of the range for the child's age, developmental level, and culture. Obviously, with such a broad definition, there can be a great variance in incidence and prevalence, and it depends on where you draw the line. We're talking about a spectrum of disorders, for example, in hypertension, as compared to a distinct disorder. You're either pregnant or you're not. It's also difficult to determine whether or not the difficulty lies within the child or within the psychosocial environment that the child lives in. A developmental perspective is necessary. What may be normal for a 15-year-old isn't necessarily normal for a 5-year-old. And the 2 formal diagnostic systems we use in psychiatry or mental health, the DSM or the ICD-10, can have criteria that differ, meaning you can meet the criteria in one classification and not in others. CAMH, or Child and Adolescent Mental Health Services, is primarily an outpatient speciality, and only about a quarter of parents or children seek help for emotional or behavioural difficulties. In the UK, it's divided up into a series of tiers. Those who see children as part of their ordinary contact, for example GPs or school nurses, are termed Tier 1. Tier 2, it consists of a single discipline, short-term interventions. What you would normally think of as CAMHs are specialist multidisciplinary borough-based CAMHs teams, which we call Tier 3 CAMHs. Tier 4 services are rarer. They are highly specialist services consisting of either child or adolescent inpatient units or specific outpatient teams that specialise in a single disorder and are expert at those. About 10% of 5 to 15-year-olds have a mental health disorder. About a quarter of children have a psychological component to some physical presentation, for example asthma or eczema, and urban children have rates that are twice as high as that of a rural population.